Thank you, Mr. Chairman. I appreciate you and the ranking member holding this hearing. As you know, November 2022, we put out a white paper on the need to have some level of overview and people in charge in terms of cyber and healthcare. And I'd love to submit for the record
without objection, Senator Warner's statement
this
for the record.
Chart, which indicates, frankly, cyber and healthcare is dealt with by 4 separate secretariats and about 12 different entities. And I think this lack of clarity is one of the challenges. I feel very strongly, and I appreciate that the chairman's already, I think, alluded to this, and I want to hear from you, Mr. Witty. I know we discussed this when we met individually, is no industry likes minimum standards, but just as we put in energy and in finance, minimum cybersecurity standards, I think we need those minimum standards in healthcare as well. I think you've tended to agree, but if we were to put those minimum standards in place, I would want to make sure, particularly whether we're talking about change or we're talking about big United, that there be transparency in those standards. Can you speak to this subject?
Senator Warner, thank you very much. Yes, certainly I do think, and we're supportive of a direction of travel which moves towards minimum standards. I think today there is a blend of guidance, some standards and others, and I think there needs to be clarity within that. As you rightly say, there are a mix of different oversight agencies. I think that's, as you think about smaller and medium-sized organizations across healthcare, it's difficult oftentimes to navigate some of those things. So I do think a refreshed view of all of that. I think minimum standards do make sense. We'd be very, very happy to engage, and any lessons learned from this with you on that.
And one of the things I think we need is, people wouldn't be surprised if an individual provider was attacked or the United parent being a huge entity. But, my understanding of change is, in effect, they were the rails that folks didn't understand, allowed the doc or the insurer and provider to kind of communicate information better. I think if we think about these minimum standards, it has to be all the way up and down the food chain. You can't just check a box and say, well, as a provider, I'm covered. We've got to go trace back through that whole supply chain in a way that, again, quite honestly, I'm not sure we have enough transparency in the system overall. I also believe, and I think we said, since this was multi-factor authentication problem, you guys are the biggest in the business. And the fact that I know you had acquired Change, you were 2 years into the acquisition, and you still had not put the type of standards that United Corporate would already have in place into Change. Why was it taking so long?
Senator, thank you for that question. That is very much still, we're trying to dig through exactly why that server had not been protected by multi-factor authentication. I'm as frustrated as anybody about that fact, and we are working to try and understand exactly why it was not covered at the time.
Well, Mr. Chairman, this is one of those areas where if we don't have, I think, resilience. I mean, I've got providers that have not only gone through literally weeks of not being able to have payments made and lost such faith in Change that they are now talking about getting a new provider. That adds more and more weeks. In the meantime, patients, providers, others are not getting their payments made. So I think we need to look not only at a minimum standard system, but also how we build resiliency into this system. I think the whole business model here, if any entity that is providing, in effect, the connections, from a telecom guy, as I used to be, those connections between docs, providers, insurers, there's got to be a backup system in place. And whether that means within a single provider like Change/United, you'd have a backup system, or whether the whole model, business model has to change so that whoever you sign up, you have a backup in reserve, because without that, you've got the kind of crisis that the system has prevented here.
So,
You
Senator-
said you were going to try to change that model. Can you speak to that for a moment? I know my
Totally.
time's running out.
So, Senator, certainly agree with that sentiment, and which is we would encourage people to have backup systems. Those providers who had two alternatives, they were able to fail across to their backups and were able to carry on without interruption, essentially. Some did not have those backups. We need to work with those providers to make that possible and help them to be able to have that second pipeline, if you will, or that second rail, which would allow them to have failed across to that if there'd been a technology failure on the first system.
Well, I know, Mr. Chairman, you want to take on this issue, and I look forward to working with you. I know Senator Cassidy's interested, but I think this is a time that's well overdue. We were just waiting for a crisis like this to happen, and we knew it was going to happen. Now I think we need to act. Thank you, Mr. Chairman.
I think those points are well taken, Senator Warner, and I think that there's an opportunity to link up a number of these issues. As I understand it, your proposal is essentially a Medicare-related kind of effort. We have begun working, the Finance Committee staff, which is available, of course, to all of the members, because we have jurisdiction over the HIPAA security rule as well, which gives us a chance to look at some of these issues relating to enforcement and standards and accountability. And I think your point as it relates to kind of resiliency allows us, and we've started it this morning, to kind of walk through how all of this actually works. I mean, you can't walk into a coffee shop in most of America and talk about multi-factor authentication. I mean, everybody would just kind of look at you kind of, what planet have you descended from? But that's all about prevention. But Senator Tillis came in and gave us a chance to make a link between prevention and getting everybody up and running again quickly, which is what the redundancy effort is all about. So as we link up these issues and work in a bipartisan way, there's lots to do, and I look forward to working with my colleagues.